Careblazer, I recently had the opportunity to sit down with a company I have a lot of respect for. It's a company that helps seniors choose the best possible Medicare plan for them. As I started researching for this meeting and learning more about Medicare, I quickly became overwhelmed and confused. I learned a lot. Like, did you know there are over 24,000 Medicare plans? How in the world is somebody supposed to know what the best plan is for them? Plus, people who choose the Medicare plan that they think is the best for them at the time, every year those plans change. There's adjustments. How do you keep up with all those changes? So I sat down and talked with Ari Parker, one of the co-founders of the company chapter, and we talked about things like what are costly mistakes seniors should avoid when it comes to choosing a Medicare plan? What should seniors be wary about or cautious about when working with other Medicare brokerage companies? For example, we talked about how the Department of Justice has filed claims against several Medicare brokerage companies because what many of them do is they only provide seniors the plans that give them the most kickbacks. So unfortunately, sometimes it's not even about the plan that's best for you, it's about the plan that fills their pockets more. And the thing that makes chapters so different is that the people who are helping you choose the best plan for you, they are blinded to what that insurance company pays, meaning they have no incentive to show you certain plans that make them the most money, and they have no incentive to hide the plans that don't make them money because they have no idea. All good research studies are blinded, meaning the researchers involved in the study have no idea who are the control people, like who are the plants, and who are the true patients. And so they're doing it correctly. They're doing it amazing. I have a lot of respect for this company. What I'm going to do, I'm going to share Ari's answers to some of these common Medicare questions because open enrollment or the period to make changes and get on a plan is now. And so I don't want you to miss this opportunity. And there is a specific number and website you can use to work with them. It's totally free and they're going to make sure all of you Careblazers are taken care of. I would love to know if you have any other questions, comments, concerns. Please let me know. I've never done a video like this before, but I think it's incredibly important because I do hear a lot of Medicare questions happening, and you can leave them in the comments below or you can literally just email us directly. All right, let's hear what Ari has to say. Ari, thank you so much for being here and to share this important information with our audience. I want to start out in the most simplest way. Can you tell us what exactly is Medicare?
Thanks so much for having me, Natalie. Medicare is health insurance for people who are 65 and up commonly. It is also health insurance for those who are under age 65 and receiving cash disability benefits for 24 months or more. If you are younger than 65, you may also have Medicare by way of end-stage renal disease or by way of Alzheimer's.
So I am not a Medicare expert, but I know that around this time of year, it seems like my TV and commercials and ads, everybody seems to be talking about Medicare, and it seems very complicated and overwhelming. And I'm not somebody who has it, and I'm not near that yet. But can you explain a little bit, like, why is there all this talk of Medicare? Why does it seem so overwhelming and confusing?
The reason you see so many commercials around Medicare in the fall is because that's the opportunity for people to adjust or review their coverage for the upcoming year. This is called the annual enrollment period. It's from October 15th to December 7th. And this is the time when people who are on Medicare can make adjustments for the upcoming year.
So why would somebody want to make an adjustment to the plan they currently have?
Because the plans can change every year. It depends on what type of coverage they have. The biggest mistake we see people make is that they just have original Medicare. That is Part A and Part B. And to unpack these terms a little further, because I know the terminology can get confusing. Part A is your hospital insurance. It means you have a wristband. Part B is your outpatient insurance. It's for everything outside the hospital. So in order to get comprehensive coverage, people have two options. They can either choose a Medicare supplement plan, which is the most comprehensive and flexible type of coverage. And if they go this route, they would just need to add a standalone prescription drug plan. Alternatively, they can choose a Medicare Advantage plan, which is a replacement for original Medicare administered by a private insurance company. And Medicare Advantage plans are what people see a lot of advertisements around in the fall.
It's kind of a lot and complicated. I'm wondering, so could somebody technically have the Medicare plan that they want and that specific plan change without them necessarily knowing in terms of what's covered and what's not?
It can happen. What people receive in the mail before the annual enrollment is called the annual notice of change. This will describe how your plan will operate in the upcoming year. So you want to take that annual notice of change if you're on Medicare, and then you want to go through your three Ps for the upcoming year. That's what we call them here at Chapter, the three Ps. Those are your providers, who are the doctors that you want to see, who are the doctors you would want to see if your health changed. Your second P is your prescriptions. What medications do you take? Brand name or generics? What pharmacy do you like to go to? A national chain or a mom and pop drugstore? And then finally, write out your priorities for the upcoming year, and then schedule a consultation with an independent, unbiased Medicare advisory to evaluate all your options, or go to Medicare.gov.
About how many different plans are there that people could be looking at?
There are over 24,000 plans nationwide. This is one of the biggest misconceptions. People think that because original Medicare comes from the government, that it covers all of their costs. It still leaves you responsible for at least 20% of your medical costs out of pocket, and there's no cap on that 20%. So my mom lives in the Chicagoland area. She needed a knee replacement last summer. It's a $50,000 procedure. Mom would have owed $10,000 for her knee had she not had some type of additional coverage. There's a lot of different options to choose from, and they vary county by county across the United States. So make sure that you work with someone who can sort through all your options wherever you may live.
So let's be real here. 24,000 plus. How does somebody even begin? I'm thinking of, even if you are somebody who tries to help people choose the best plan, how do you go through all of those plans and give them due diligence to figure out which one is going to best suit that person's needs?
It starts with your three Ps. So it starts with your providers, your prescriptions, your priorities. And you need to work with someone who can sort through your providers, your prescriptions, and your priorities, and then match you to the single best fitting plan based on your three Ps.
The people that you're working with, like there's people you work with to help you make sure you're choosing the right plan according to your three Ps. Are they actually going through every plan that is available to them? It seems like it's a lot of work.
That's absolutely right. If you're responding to an unsolicited phone call, a spam text message, or a direct mailer, you're probably working with someone who's captive to a single insurance company or maybe two or three insurance companies. And they're only showing you those two or three options. But you know, by virtue of watching this channel, that there's hundreds of insurance companies offering thousands of plans. And the right one for you is going to depend on your three Ps. So work with someone who has all the options available at the touch of their fingertips. And the only company that can say that is Chapter. Or you can go to Medicare.gov.
Okay, so why would certain companies only share a handful of possible plans?
Because those are the only plans that pay them. That's why. It's self-interest.
So,
And it's a broken industry. That's why we started Chapter 6 years ago, because there is no duty to act in the patient's best interest. And that is a tragedy because it has led to so many worse health outcomes. And it's also led to extravagant costs when people realize that their doctor is out of network and they owe 100% at the time of service.
wow.
So from day one, what we've always done is start with your three Ps and then help you evaluate all your insurance options, which means sorting through hundreds of insurance companies offering thousands of plans depending on where you may live.
Okay, so it sounds like a lot of the companies that say they can help you choose a plan, many of them are only showing people selective plans that they get kickbacks from. Am I understanding? Like,
Not necessarily kickbacks, but they earn revenue
okay,
from only those plans that they're contracted with. And so they only show those plans that they're contracted with. Even if people are well-intentioned, the question is, what tools are they using to help you sort through all your options? You might say, well, they're using Medicare.gov. But if you go to Medicare.gov, you can't even enter your doctors for certain plans to see whether your doctor would accept that insurance company you're considering, which is a shame and something that we're fighting to change. In fact, our CEO testified in front of the Senate about this very problem with Medicare.gov.
Yeah, it seems incredibly overwhelming and confusing, and then maybe even a little bit deceiving sometimes from like if seniors are searching for a plan, the ones that they're being put in front of might not be like the options. Technically, they might not be the absolute best options for that person. So, can you spend a little bit of time? Because I met with two people from your company, I think last week, and I was blown away just at how you were doing things differently. I was not aware of how a lot of people choose their Medicare plans. Can you explain what Chapter does and how it's so different from a lot of these other companies that are helping people choose plans?
We do dozens of things differently than how it's been done. That's why it's been incredible and so gratifying to help tens of thousands of Americans make sure that they're on the right coverage or to help them get set up with Medicare in the first place. I'll name a few ways in which we're different than anyone else your clients may, or excuse me, your viewers may have
Yeah, yeah.
worked with. So, first, our advisors start with your three Ps. So we go based on your providers, your prescriptions, and your priorities. Then we match you with the single best fitting plan and, in fact, provide a short list of plans for us to help you consider and evaluate your options. Then we handle all the paperwork for you and we provide year round ongoing support, which means fighting for you to the end of the earth and back. So, for example, if you misplace your ID card, we'll help you get another one. If you have a question about a claims invoice that you receive from the doctor, we'll help you decipher it. And if you go to the pharmacy and the copay seems outrageous, we'll see why you're being charged so much and get to the bottom of it on your behalf. No one else can really speak to that type of service and ongoing support. It really is concierge Medicare guidance for your viewers.
And I was blown away too in talking to some of the people who work there that your employees are not incentivized from the insurance companies. Like they're not incentivized to show people certain plans only.
Our advisors are actually blinded as to which plans Chapter earns revenue from and which ones we don't. So the only thing that matters to our advisors is making the single best fitting recommendation for one of your viewers,
Yeah,
or for anyone for that matter.
that's absolutely amazing. Now, I have heard of some, I guess, would you call them Medicare brokerage companies? I'm not if that's the right term, where basically they would they charge someone to go through all the plans and look through them with them and help them choose the right plan. Is that how it works with you guys?
No, we don't charge. There's no charge to use Chapter. The
Okay.
way that Chapter earns revenue is from insurance companies, and we're contracted with many, many different insurance companies. So it's more than likely that the insurance company you end up choosing is one that we earn revenue from. But in the subset of cases in which it's not an insurance company we have a contract with, our advisors are blinded as to which ones we earn revenue from and which ones we don't. So all that matters is making the single best fitting recommendation. That's our North Star. We will always do what's best for the person we're helping.
That's amazing. Now, you mentioned in the beginning that it's coming upon the season where people can start to make changes. So, should everybody who is currently on Medicare be reevaluating their plan every year?
100%. The fall is the time to reevaluate your coverage for the upcoming year. The annual enrollment period is from October 15th to December 7th, and this is the time to make sure that you're on the best fitting coverage for 2026. What people might be unaware of is that the plans can change every year and the regulations change. For example, for 2026, there is a maximum out-of-pocket cap on your prescription costs, and that cap is $2,100. But in order to take advantage of it, each of your prescriptions must be covered under the plan that you choose for next year. So make sure that you review your coverage between October 15th to December 7th.
Okay, can you explain how would it work if somebody is thinking, "Oh my gosh, the time to review everything is approaching. I would like to, speak to a company that has my best interest at heart." How does it work to actually work with Chapter? What's that process like?
So when one of your viewers calls Chapter, they will have a one-on-one 45-minute conversation or longer based on their three Ps, their providers, their prescriptions, and their priorities. And we're going to find out what's important for you to have covered under your Medicare. And this coverage can look very different for someone depending on their health needs and depending where they live. And then we're going to provide a short list of plans to discuss with you and help you end to end apply for the coverage of your choosing, and then make sure that it's working for you throughout the year.
Are they actually getting a real life person when they call?
1000%.
So They can call the number, get a real life person. You'll help them review the plans that are best for them based on their three Ps, and there's absolutely no cost to them.
Yes, that's right. And it's not just a real life person. It's someone who's gone through a rigorous training and ramping program with yours truly before we let them work with clients. And they have all the licenses. So depending on what state you're in, the rules are different for that state. And the person that you speak with at Chapter, the licensed Medicare advisor, will know all the ins and outs.
When can people actually start getting information about this, calling Chapter, starting to look into change?
So three buckets. The first is for those who are turning 65 and have a 1960 or a 1961 birthday in the first half of the year. Now is the time for us to help you get your Medicare set up as you approach 65. For those who are past age 65 and still working for a large employer, rule of 20 means 20 employees or more, or their spouse works for an employer with 20 employees or more. If you're retiring before the end of the year, now is the time for us to help you get your coverage set up to make sure that you don't experience a gap at the start of 2026. And then finally, for those who are already on Medicare, we can discuss your 2026 plan options as early as October 1st. And the time for us to submit those changes would be October 15th to December 7th.
Now, because we're recording this and it's going to go on my YouTube channel, somebody might be coming across this video in July. Does this mean they can't do anything with this information? They just need to save the number for later? How does that work?
It depends on the person's circumstances.
Okay.
If they recently moved, for example, that would create a special election period for them to choose different coverage.
I came across something recently about the Department of Justice maybe suing or filing a claim against several Medicare brokerage companies. Are you aware of this?
Yes.
What are they suing for? What's the claim for?
Natalie, thank you so much for bringing this up. These insurance companies and Medicare brokerages are being accused of is actually steering certain enrollees into some plans and steering other enrollees away from these plans if they were too sick because they didn't want to provide insurance to them, even though there's actually no insurability questions. So they were paying, in other words, what's alleged is that they were paying kickbacks in order to push some seniors away from these plans, even though they may have been optimal based on their needs.
It's horrible. That's absolutely horrible. It seems like it should be standard that everybody should be blinded to what the insurance companies are paying.
That's our position. That's exactly right. And that's why we started Chapter 6 years ago. And that will always be true at Chapter. It will always be based on what's in the best interest of the person we're helping.
A final question that I'm curious about, just to kind of wrap this up, it's been super helpful. What would you say are maybe some of the top mistakes seniors make when it comes to their Medicare plans?
Yes, costly Medicare mistakes to avoid. There are so many of them. I'll mention a few here. One is something that your viewers can avoid right now, and that's review your coverage for the upcoming year. Many seniors won't review their coverage, and that's a shame because your plan is changing for next year, and it's important for you to review whether that is still the right coverage for you. And the time to do it is from October 15th to December 7th during the annual enrollment period. The other mistake that we commonly see people make is they don't sign up for Medicare in time. And if you don't sign up for Medicare timely, then you're subject to late enrollment penalties. And also, Medicare is likely designed to be your primary insurance unless you or your spouse work for a large employer, which means 20 employees or more. So make sure you're aware of your Medicare enrollment deadlines, and that's certainly something we'd be glad to help you with. One of the biggest misconceptions is that it's very time-consuming to apply for Medicare. It actually takes less than 5 minutes if you do it through your online Social Security account portal. It's fast, safe, and secure, and if you need any help getting your red, white, and blue card, that's exactly what the Chapter team is here to help you with.
Is there anything, Ari, that maybe I haven't asked or some sort of piece of information that you're like, it's really important for your viewers to know this and I've somehow missed it?
There's no charge to work with a Medicare advisory. Make sure that you're working with someone who's independent and unbiased, or you can go to medicare.gov. Of course, we'd be delighted to help you here at Chapter, and just make sure that if you're on Medicare, that you review your coverage during the annual enrollment period from October 15th to December 7th. That's
Are
what's
there
really
any
important.
red flags that seniors should be aware of if they're talking to some sort of Medicare brokerage company, like anything that should send off alarm bells, like these people might not have my best interests?
Yes, well, if it's an unsolicited phone call,
Okay.
that should raise alarm bells. If it's a spam text message or a direct mailer, be wary of giving out your personal information to the person that you're speaking to. Make sure that it's someone you trust and that you contacted them in the first place or gave your permission to be contacted.
This is so helpful. I know that a lot of our viewers are about to, come up on their time to make changes or maybe even apply for the first time. So, Careblazers, if that's you, or you're just, wanting help, want to know if you're on the right plan, want help applying, whatever it is, if it is a Medicare question, you're more than welcome to reach out to Ari and his team at Chapter. You can go to askchapter.org/careblazers, or you can even give them a call at 504-490-0080. I'll make sure to link it all into the description below. It's also here on the screen for you to view. But Ari, thank you so much for providing this information that it's super overwhelming and confusing. It's a lot of information to digest. So thank you for helping us understand some of the costly mistakes, things to look out for, and truly thank you to Chapter for providing this much needed service to seniors.
Natalie, thank you so much for having me on your channel, and thank you for the community that you've built and to all the Careblazers out there.
Thank you. Thank you so much, Ari.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.